Humans are fascinated by gore and violence, but even more so the mysterious and unsolved. This interest in disturbing and unpleasant subjects is called morbid curiosity, and it has gripped hundreds of people throughout the ages. I am one of those people. My name is Hallie, and this is the Morbid Curiosity Podcast. During the studies leading up to my osteology degree, I had the honor of working with many skeletons. A specific skeleton that stands out in my memory is Chichester 277, an individual housed by the Biological Anthropology Research Center at the University of Bradford. The skeleton was that of an elderly adult male who had been buried in a cemetery associated with a leprosarium. Leprosariums and leper colonies became widespread in the Middle Ages, particularly in Europe and India. They were essentially places to quarantine people with leprosy, now called Hansen's disease, and were often run by monastic orders. People with leprosy were quarantined because of the fear that surrounded their disease. This fear was generated by the very visible disfigurement and disability caused by the disease, the belief it was incurable, and the common misconception that it was highly contagious. People with leprosy were sent to these institutions to live out their lives away from the rest of society, and were normally buried there away from their families. When I say Chichester 277 was buried in the cemetery, it would have been more accurate to say that he was actually laid to rest just on the other side of the cemetery wall, separate from the other graves. The placement of Chichester 277's grave suggested to me that even the lepers, historically spurned and feared by much of society, had not wanted this individual buried amongst them. Before my paleopathological analysis of the skeletal remains of Chichester 277, that is, an assessment of what signs of disease are present in archaeological remains, I assumed Chichester 277 would have leprosy, as he was buried near a leprosarium. Though they were similar, the lesions or pathological markers on his skeleton didn't match those of leprosy. As I analyzed the skeleton further, I found a special type of lesion associated with one specific disease, one with a stigma all its own. This disease has spattered the pages of history on every continent and brought down both beggars and kings. Its name is syphilis, and it piqued my curiosity. Syphilis is an ancient disease of unknown origin. There are many theories about how it came to be spread across every continent. These include Columbus bringing it to Europe from America, and the disease evolving itself as humans spread across the globe. Before I elaborate on the contested origins of syphilis, I want to talk about the disease itself and its history. Syphilis is one of several diseases called treponematoses. It is caused by a corkscrew-shaped bacterium, or spirochete, called Treponema pallidum. Transmission of the disease is through sexual contact with other infected people, though rarely transmission has occurred indirectly through expelled body fluids or the sharing of needles. The other treponematoses include Bagel, Pinta, and Yaws, which are all related to syphilis but are not the same disease. I want to warn you ahead of time here that I'm about to describe the symptoms of syphilis in detail. If you're squeamish, you might want to fast forward through this part, or perhaps seek out a different podcast. Once infected, the bacterium incubates between 10 days to 10 weeks, with the average incubation period being 3 weeks. Before this time, no symptoms are produced. After incubation, a type of lesion called a chancre erupts, usually in the groin area. A chancre is a single, firm, painless, non-itchy skin alteration with a clean base and sharp borders. The chancre fades after a while as the bacteria move into the lymph nodes. From the lymph nodes, the bacteria spread to the bloodstream, where it is circulated throughout the body. This is the secondary phase of syphilis, and during this phase a rash develops and sores appear in the mucous membranes of the face. The rash is symmetrical, meaning it occupies the same area on both sides of the body. It is reddish-pink, non-itchy, and appears on the trunk and extremities, including palms and soles of feet. In the mucous membranes, usually inside the nose, flat, broad, wart-like lesions known as condyloma latum form. Again, these symptoms fade after a few weeks. Between 2 and 10 years after infection, the organs, skin, and bones become infected. When this occurs, the disease is in its tertiary and final stage. In all tissues affected, large tumor-like nodules appear. These nodules have necrotic centers, meaning that the center of the tumor is dead and rotting. This type of lesion is called a gumma, and it is the identifying symptom of syphilis. In Chichester 277, I found the remnants of these nodules, which appear on a skeleton as if someone has used a marble-sized melon baller to take a scoop out of the bone. This is where the necrotic center of the nodule was. In life, these nodules are pussy lesions that often burst, then dry and harden into scabs. Gummas are most often found on the lower legs, the collarbones, the thighs, the lower arms, and on the face and scalp. Some of these lesions on the scalp become so numerous that they combine to form one large lesion. This is called caries sicca, which means dry rot in Latin, and in skeletal remains that is exactly what these lesions resemble. In a living person, these massive lesions look like numerous small nodules on the skull or larger tumor-like bumps. Aside from gummas, the rest of the body is racked with chronic inflammation or swelling of the joints and other tissues. If the bacteria spread to the spine, it affects the central nervous system. This is called neurosyphilis and causes a loss of pain sensation. Because the infected person can't feel when they're injured, joints are exposed to repeated trauma and become unstable and degenerate. The bones can break down and disintegrate as the body tries to fight the secondary infection. In the late stages of neurosyphilis, the infected person suffers memory disorders, personality changes, and impaired reasoning. Syphilitic meningitis can also occur, which causes intense headache and fever, sensitivity to light, and muscular rigidity, leading in severe cases to convulsions, delirium, and death. The signs of tertiary syphilis were present on the skeleton of Chichester 277. Not only were gummatous lesions present on his shins, he had joint inflammation, facial lesions, and many other sites of infection. It is likely due to his age and the severity of his lesions that he advanced to tertiary syphilis and suffered all the symptoms mentioned above. Because of the dementia suffered at this late stage, many people infected with syphilis were considered mad by their peers. They were often locked away or driven out of town. This could be how Chichester 277 ended up in a leprosarium. The effects of the disease on an individual are terrible enough, but it gets worse. If a woman is pregnant or becomes pregnant and is also infected with syphilis, the disease can pass to the child. This is called congenital syphilis, and it causes a slew of deformities if the baby lives to be born. These include dental defects like notched incisors, deafness, facial lesions, saber shins, which is the sharp bowing of a tibia or shin bone, and intestinal problems. Though the symptoms of modern syphilis are severe, historic descriptions of the disease are far more horrific. Several historical documents report giant abscesses and huge ulcers that turned into pockets of pus that ate away at the skin on the face and nose and caused skin to fall off. These more extreme symptoms could be due to the fact that there was zero immunity at the time, so the disease devastated the people it infected. It could also be due to the fact that sanitation was not what it is today, and secondary infections of these open lesions were far more likely. Around AD 1000, the disease was everywhere in the form of treponema parasites. But due to small group populations, the effect was mild and chronic. The first time a disease matching the modern symptoms of syphilis was mentioned in history was in 1494, when the French invaded Naples. The French armies not only plundered the town, they ravaged its people, and a strange disease began to crop up afterwards, one that was obviously spread by sexual contact. The writer Voltaire said of the French army as they marched back to France, "On their flippant way through Italy, the French carelessly picked up Genoa, Naples, and Syphilis. Then they were thrown out and deprived of Naples and Genoa, but they did not lose everything. Syphilis went with them." The disease appeared in India in 1498 and in China and Japan in 1505. By 1510 it rose to epidemic proportions, especially in Japan. The frequency of the disease then mysteriously decreased all over Europe in the late 16th century. At the time, the disease was known by many names, which varied depending on the region. In Germany, it was called the French disease. In France, it was called the Italian disease. In Holland, it was the Spanish disease. In Russia, the Polish disease. In Turkey, the Christian disease. And in Tahiti, it was the British disease. All these regions blamed foreigners or colonizers for their suffering. Syphilis was also referred to as the Great Pox, Cupid's disease, and the chancre from the first stage was sometimes referred to as the Black Lion. As time passed and people began to realize this was one disease that affected them all, the blanket term of syphilis was applied. The name actually comes from a poem written by mathematician and physician Girolamo Fracastoro in 1530. In the poem, a man named Syphilis curses the Greek god Apollo for a drought. In retaliation, Apollo curses him with the disease. Near the end of the 14th century, an artist, Jan van der Straet, painted a detailed scene in which a wealthy man was receiving treatment for syphilis with a tropical wood called guaiacum, which at the time was thought to be holy. The work is called Preparation and Use of Guaiaco for Treating Syphilis. This work is evidence of how important a treatment for syphilis was, however ineffective, to the European elite at the time. Because it was known that the disease spread through sexual contact, it became known as a sinner's disease. In 1495, the Holy Roman Emperor Maximilian I publicly proclaimed the disease was a punishment from God. As penance, the sufferers were not supposed to seek treatment but die for their sins. Stigma, which had already developed around those infected, was now condoned by the Church. The symptoms of syphilis are not something a person can hide in its later stages. Those affected by it were not only suffering from the disease, they were marked as a sinner. Due to the stigma, people sought ways to hide the syphilitic lesions that marked them. Their methods included thickly applied makeup and a surgical procedure that attempted to replace or rebuild a missing nose, the first ever attempt at plastic surgery. I found the procedure very interesting, so I'll share it with you. With the rise of surgery in the 16th century, it's no surprise it was applied to deformations of the nose and face that occurred due to syphilis. In 1460, a knight, Heinrich von Falspaint, described the use of an arm flap graft to repair the nose, a procedure he claimed to have learned from a foreigner. In 1597, Gaspar Tagliacozzi, a professor at the University of Bologna, published his book De Curtorum Chirurgia, which described and illustrated the use of pedicle flap grafts to reconstruct the noses ravaged by trauma or syphilis. The technique was simple. A graft, or small bit of skin, still attached to the arm, was draped over the stump of the nose for as long as 20 days. An apparatus of belts and pulleys was used to hold the arm in place near the face for the full time required for the skin to graft. So the person had their arms suspended in front of their face for 20 days. If that doesn't raise your eyebrows, this might. It often took at least 6 procedures and a span of more than a month, with risks of infection, pain, and a great deal of discomfort and inconvenience, before a sort of normal-looking nose was created in this way. Talk about pretty hurts. By hiding their infection, people may have put others in danger, but they were trying to protect themselves. Remember, syphilis wasn't just an illness. It was looked down on by society as proof of immoral action. The afflicted were ostracized and thought of as evil. Perhaps this is why Chichester 277 was buried beyond the walls of the cemetery. Even the lepers, feared and hated by society, did not want evil buried among them. Syphilis itself eventually affected the power of the church. Nuns and priests were supposed to be celibate representatives of God, but many were infected with the disease. Because of this, people began to question the absolute holiness of church figures. There were early attempts to stop the spread of syphilis during the 1520s. King Henry VIII, who himself is suspected of having the disease, tried to close down brothels, public mixed-sex baths, and regulate prostitution by forcing infected women out of the profession. Much of Europe also employed similar regulations. Thankfully, syphilis is easily treated today with antibiotics. This was not the case for most of human history. In the 1800s, medical thinking on the disease began to advance. Many accounts of the symptoms were recorded, and ideas put forth for the origin of the disease. Besides the use of the holy wood guaiacum, many attempts were made to treat syphilis once it was acquired. Of these, mercury, arsenic, and vitriol were commonly used. The most popular was mercury. Mercury is a chemical element that occurs in deposits throughout the world as cinnabar. It's highly toxic and can cause chronic and acute poisoning. As a treatment for syphilis, it was injected, used topically as an ointment, eaten, and even absorbed by fumigation. Many of these treatments were done in a small room next to a hot fire. The patient would be subjected to the treatment for a week to a month or more. Arsenic and vitriol, known today as sulfuric acid, was also sometimes used in tandem with mercury. The stigma surrounding syphilis remained into the 19th century, and treatments using mercury became more subtle. One of these under-the-radar treatments was a chocolate-flavored drink laced with mercury. It was meant for men to give to their wives and children so they could be treated for the disease without the man having to tell them they had it. The things people will do to save face. Sorry, I love puns. A saying that was heard around this time was, "A night with Venus and a lifetime with Mercury." Philippe Ricord, a sex experimenter who may earn his own episode for his self-experimental methods, broke syphilis into 3 stages in 1863. He also sought to solve the puzzle of gonorrhea and whether or not it was an early stage of syphilis or its own disease. He did this by way of self-experimentation, taking the pus from one of his syphilitic patient's sores and injecting it into his own penis. He then contracted both syphilis and gonorrhea, because his patient had both. This did nothing to answer his question, but he was able to document the stages of syphilis firsthand. The initial chancre that appears in first-stage syphilis was then named Ricord's chancre after him. The 3 stages of syphilis were later confirmed in the modern era by a horrific study done in Tuskegee, Alabama, by the U.S. Public Health Service from 1932 to 1972. During the course of the study, the U.S. Public Health Service did nothing to treat the disease in the rural African American population they used as their subjects, and sometimes did not even tell the men that they had the disease. When World War II started and many of the men enlisted, the U.S. Public Health Service actively prevented the U.S. military from alerting the men that they had the disease. It was a disgusting period of medical history, affecting not only the men in the study but their wives and children too. Unfortunately, this study is where most of the information about the modern progression of syphilis comes from. There is contention on whether or not it is ethical to use such information as it was gained by devious means, but that is a subject for another podcast. In 1905, the organism responsible for syphilis was isolated, and a test to determine whether or not someone was infected was created by Paul Ehrlich soon after. In 1908, the first effective treatment was developed. It was an organoarsenic compound called salvarsan, or compound 606. Although it did kill the disease, it was also toxic in ways similar to chemotherapy, with side effects like hair loss, kidney problems, and loss of limb. In 1943, penicillin was discovered and spelled the end of many bacterial infections, including syphilis. The beast was at last conquered. Where did syphilis come from in the first place? Syphilis was indisputably present in the Americas before Europeans came in contact with native peoples, but it's debatable whether or not syphilis was also present elsewhere in the world at the time. In 1532, Niccolò Leonceno, an Italian physician and humanist, proposed syphilis was not a new disease, but an old one in a new form. This theory suggests that before Columbus returned from the Americas, syphilis was already present in Europe, but was either very mild or not distinguishable from other bone remodeling diseases. Syphilis has been called the great imitator because of the varied presentation of symptoms. In archaeological remains as well as historical and clinical literature, syphilis has often been mistaken for leprosy, tuberculosis, cancers, and Paget's disease, a chronic disorder that can result in enlarged and misshapen bones. According to this theory, the emergence of the more rampant form of the disease in the 15th century can be attributed to either improved medical and lay recognition of the disease or an especially virulent New World strain of the same disease. Several researchers also theorize that sexually transmitted treponemal disease evolved in response to increased population density and urbanization, both of which occurred in the 15th century. This theory that syphilis was already present in Europe before Columbus returned from America is called the pre-Columbian theory. Two Spanish authors suggested in 1537 that syphilis originated in the Americas and came to Europe with Columbus. Many authors of the time accepted this theory, and it's still popular today under the name the Columbian hypothesis. The Columbian hypothesis is best supported by the fact that the first outbreak of what we know as modern syphilis occurred in Spain in 1493. A lack of solid evidence supporting an Old World origin for the disease also supports this theory. A third theory was recently discredited, but I want to mention it anyway. The Unitarian hypothesis suggested that treponematoses are environmentally determined expressions of a single and extremely flexible disease. According to this hypothesis, syphilis was a product of improved hygiene, which hindered the skin-to-skin transmission of the endemic treponematoses. This theory was discredited by genetic evidence that showed that the three treponemal subspecies, which I mentioned earlier, Yaz, Bajal, and Pinta, are genetically distinct and have evolved along different trajectories than syphilis. Despite disproving one of these theories, to this day the exact origin of syphilis remains hazy. With a disease so prolific, it's not surprising that many famous and historical figures suffered from syphilis. Musician and composers Schubert and Delius, artist Vincent van Gogh, Henry Toulouse-Lautrec and Manet, writer Flaubert, visionary and pilot Howard Hughes, and gangster Al Capone all suffered from the disease. There are several suspected cases of syphilis amongst the historic and famous as well. These include philosopher Nietzsche, composer Beethoven, President Abraham Lincoln and his wife Mary Todd, French conqueror Napoleon, 16th century Tsar of Russia Ivan the Terrible, English King Henry VIII and probably all of his wives by proxy, playwright Shakespeare, Italian adventurer Casanova, and writer Tolstoy. Adolf Hitler is also thought to have had syphilis. The later stages of the disease may explain, but not expunge or excuse, some of his actions near the end of his life. He is said to have blamed his infection on a Jewish whore. I think he meant to blame the Jews yet again for the world's suffering, but this accusation was also an admission to sleeping with whores without regard to their religion. A contemporary of Hitler's, Mussolini, was also rumored to have had syphilis during that time. Syphilis has been referenced in poetry, art, and even modern films. As I mentioned before, Girolamo Fracastoro wrote a poem about syphilis in 1530. Theodore Rosebery in 1971 also wrote a poem about it, describing the symptoms of syphilis. John Keats wrote of the poison women or femme fatales, referring to prostitutes infected with the disease. Depictions of syphilis appear in woodcuts as early as 1496 and are seen throughout art history. Some notable works are those of Henry Toulouse-Lautrec, who painted many scenes involving the disease in the late 19th century. The Inheritance, by Edward Munch, painted in 1897, shows the devastation of congenital syphilis. Picasso also painted his fear of syphilis in the work The Wages of Sin. A 1992 stage play written by David Feldshuh called Miss Evers' Boys was written about the Tuskegee study. In 1997, it was adapted for HBO and was then nominated for 11 Emmy Awards. It won in 4 categories. The Tuskegee study also inspired a 7-issue Marvel comic book series called Truth, Red, White, and Black in 2003. Written as a prequel to the Captain America series, the comic explores the exploitation of certain races for scientific study. In television and film, the representations of syphilis are plentiful. In the 2001 movie From Hell, an English prince's downfall due to syphilis spurs Jack the Ripper to go on a vengeful rampage against the prostitutes of London. In the 2003 film Pirates of the Caribbean, Captain Jack Sparrow, played by Johnny Depp, has a suspicious facial lesion on his chin, which may represent syphilis, albeit not accurately. Yet again, Johnny Depp flirts with syphilis in the 2004 film The Libertine. This time he plays an English earl and poet who drank and debauched his way to an early grave. The portrayal of syphilis in this film is fairly accurate and not for the faint of heart. In the very first episode of Call the Midwife, which aired in 2012, the main character Jenny's first patient is a woman who is pregnant and has syphilis. The surgical reconstruction of a nose lost to syphilis is portrayed in an episode of The Nick, the 2014 Cinemax TV series about a doctor in a New York hospital during the early 20th century. The series is inspired by a real surgeon named William Stewart Halsted. In the late 1800s, Halsted championed the benefits of cleanliness and sanitation in surgery, an idea he was laughed at for. In the episode, Dr. Thackeray, who is played by Clive Owen, attempts to repair the nose of an old flame whose husband's affairs resulted in her own infection of the disease. He uses the technique I mentioned, the nose-to-arm skin graft. Syphilis has kept our attention throughout history, and even today the word syphilis brings with it a certain fear. There is still mystery attached to it after so many years, which is why it still brings out our curiosity. Morbid Curiosity podcast was produced by HMS Lloyd. If you want to get in touch or make suggestions for other morbid topics you're curious about, you can tweet the show at Morbid Podcast or join us on Facebook at facebook.com/morbidcuriositypodcast. My name is Hallie, and until next time, thank you for listening.